The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. Hello everyone, this is Karen Nickel, family nurse practitioner, and this is Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. Again, I want to remind you about my course called the Perimenopause Answer. If you are going through this phase of life called perimenopause, or if you don't know if you're in perimenopause, I would love to have the opportunity to talk to you about the course to see if it's the right fit for you. There is a link on our website, itchyandbitchy.com, and our Facebook page, I and B Podcast, where you can schedule an appointment for a Zoom call with me. When you make that appointment, I will be sitting at my desk waiting for you to join the one-on-one Zoom call. This is part 2 on the subject of HPV, human papillomavirus. As I mentioned in part 1, in my practice and in my perimenopause course, I get questions about the human papillomavirus, HPV, and what kind of risks it poses to women as we age. In this episode, I will review with you the types of cancers caused by the human papillomavirus and prevention measures. I will be talking about areas of the body that are impacted by HPV and about types of sex, so keep that in mind if there are little ones around as you listen. HPV is the causal agent of around 5% of all cancers worldwide, along with genital warts and laryngeal papillomas. Both warts and papillomas are not cancerous. Just as a refresher from last week's episode, there are about 200 strains of HPV. Of those strains, around 13 carry the ability to cause cancer. The strains which are most associated with HPV-related cancers are HPV-16 and HPV-18. Many people are aware that HPV causes cervical cancer in women. Unfortunately, this is not the whole HPV story. High-risk strains of HPV can result in HPV-related cancers of the anus, cervix, mouth and throat, penis, vagina, and vulva. We are seeing a dramatic rise in the rates of anal, penile, and head and neck cancers in men. As I mentioned in part 1, HPV has low and high-risk strains. The low-risk strains can cause genital warts and papillomas of the throat, and the high-risk strains can cause cancer. HPV can lie dormant in the body and resurface as an HPV-related cancer decades later. And researchers believe that it can take from 10 to 20 years or even longer for a new infection with high-risk HPV to develop into cancer. The following are some astounding statistics that show the impact of HPV on our cancer numbers. HPV causes 70% of oropharyngeal cancers, that's of the mouth and throat, 91% of anal cancers, 91% of cervical cancers, 63% of penile cancers, 75% of vaginal cancers, and 70% of vulvar cancers. Cervical, vaginal, and anal cancers can be caught early using a Pap test, a Pap smear. There are no standard screening tests to find penile, mouth and throat, and vulvar cancers early. Still, some can be found early during routine exams by a primary care provider, urologist, dentist, or dental hygienist, or by doing self-checks. Another problem that can arise from HPV infection is that it can cause recurrent respiratory papillomatosis, RRP. RRP is passed from a low-risk strain infected mother, so the mother carries the low-risk strain of HPV, and is passed from that mother to a child during childbirth, and it manifests in the child as warts in the throat. We would see a dramatic decrease in the numbers of cancers of these parts of the body if only we could stop HPV. But wait, We do have methods of HPV prevention. And following this quick break, I will share with you how you can prevent HPV infection and by doing so, prevent HPV-related cancers. Stay right with me. One of the most effective methods of preventing HPV and therefore preventing HPV-related cancers is vaccination. I know this word has negative connotations in the U.S. following the COVID-19 pandemic, but please hear me out. First of all, the vaccine is very, very effective, and it is the only vaccine we have that can prevent cancer. If you are vaccinated before being exposed to the virus, the HPV vaccine is 97% effective in preventing cervical cancer and cell changes that could lead to cancer. Plus, it's almost 100% effective in preventing external genital warts. 100%. The newest version of the vaccine protects against 9 of the highest risk HPV strains. This includes the strains that cause the majority of the cancers I just listed and the strains that cause the majority of papillomas and genital warts. The vaccine has been proven to be very safe with no significant risks or side effects. The clinical trials for HPV vaccines included huge numbers of participants. Each of the 3 HPV vaccines that were once available, that's the Gardasil 9 and the Gardasil quadrivalent, so it had 4 strains, and the bivalent Cervarix, so it contained 2 strains. They went through years of strict safety testing before the U.S. Food and Drug Administration licensed it. Each vaccine was found to be safe and effective in clinical trials. Gardasil, the one with 4 strains, was studied in clinical trials with more than 29,000 females and males. Gardasil 9, which covers 9 strains of HPV, was studied in clinical trials with more than 15,000 females and males. Cervarix was studied in clinical trials with more than 30,000 females. Cervarix is no longer available in the United States, but it is still used in other countries. It covers the 2 high-risk strains, 16 and 18. The more we vaccinate, the more we'll have a significant decrease in HPV transmission and HPV-related cancer. The ideal age for HPV vaccination is 11 to 12 years old, but it can be given to everyone aged 9 through 26. If you are older than 26 years old and have not been vaccinated and are at risk for a new HPV infection, you and your OBGYN or primary care physician can talk about whether you need the HPV vaccine. The vaccine is approved for people through age 45 years old now. It's ideal to be vaccinated when you are receiving your normal vaccinations during childhood and adolescence, so most of the shots are given by a pediatrician or family doctor. But OBGYNs and other healthcare professionals can also give adults catch-up shots if you were not vaccinated earlier. The vaccine is still helpful even if you have already tested positive for HPV or have been sexually active for a while. Most HPV transmission happens when people first become sexually active, but people who have already tested positive for HPV usually aren't positive for all 9 types that we vaccinate for. So in some cases, we'll recommend those patients get the vaccine if they haven't already. Even if you didn't get the vaccine early in life and have been sexually active for years, it's definitely still worth getting the series of shots. You might not yet be exposed to all types of HPV that are covered by the vaccine, and it's possible to contract more than one type of HPV strain. So you want to be covered, fully covered. Let's say you have an abnormal pap or an abnormal biopsy that shows abnormal cells due to HPV, and you have the abnormal cells removed or ablated, after the abnormal cells have been treated by removing or destroying the cells, the HPV vaccine may help prevent abnormal cells from coming back. The benefits of the HPV vaccine are monitored in the U.S. on an ongoing basis. The initial Gardasil vaccine, again, covered 4 strains of HPV, and the current version covers 9 strains of the virus. As early as 4 years after the initial version of Gardasil was licensed, HPV infection caused by the 4 strains covered in that vaccine had decreased 56% among 14 to 19-year-old females. In the U.S., within 12 years of vaccine introduction, infections with the 4 HPV types prevented by Gardasil decreased 88% among 14 to 19-year-old females and 81% among 20 to 24-year-old females. We also saw vaccine benefits in infections caused by the low-risk strains of HPV. In a study of a large group of private health insurance patients in the U.S., it was found that between 2006, the first year HPV vaccination was recommended for females, and 2014, prevalence of anogenital warts among females aged 15 to 19-year-olds decreased by 61% and decreased 44% among 20 to 24-year-olds. Small declines in males in these age groups were observed starting after 2009. The initial decline in males was likely due to the fact that girls and young women were getting vaccinated because routine vaccination of boys wasn't recommended until 2011. HPV vaccination protection lasts for more than 10 years without becoming less effective, and currently, there are studies to continue to evaluate how long the protection will last. While the vaccine is very safe, mild side effects can occur, as they can with any vaccination. The most common side effects are pain and redness or swelling in the arm at the site where the vaccine was given, dizziness and syncope, which is fainting, nausea and headache can also occur. The dizziness and fainting is most common in preteens and teenagers. And this can be prevented, and we prevented it in our office, by having the person stay lying down on the exam table for at least 15 minutes or so after the vaccination. It works like a charm. On very rare occasions, a person may have a serious allergic reaction called anaphylaxis to any vaccine, including HPV vaccines. In the United States, anaphylaxis following vaccination overall has a reported rate of 3 cases per 1 million doses administered. People with severe allergies to any component of any vaccine should not receive that particular vaccine. Other prevention measures include using barrier methods during sex, like condoms, and limiting the number of sexual partners you have. And these are very important measures to take to aid prevention. However, through vaccination, we have the power to stop an epidemic and reduce the economic and social burdens of treatment for cancer and genital warts. HPV infections have caused devastating health issues across the globe. Increasing our HPV vaccination rate is the greatest opportunity in decades that we have had to prevent cancer. Thank you for listening. Wherever you listen to this podcast, please leave a review and rate the podcast. Your reviews and ratings really matter. Also, make sure you follow the show so that it will be automatically downloaded. That matters too, a lot. I encourage you to visit our Facebook page, IMB Podcast, where you can give us a like and leave comments or questions for me. Our website is itchyandbitchy.com, where there are blogs with some of our subjects available for you to read. On the Facebook page and website, we have the information about how to schedule an appointment with me so we can chat about how my perimenopause course can help you if you're going through this phase in life. As always, thanks to my son, Forrest Wenzel, our producer and composer of our theme music, and the person who does all the behind-the-scenes work to make this podcast possible. Thank you so much, Forrest. Again, Forrest has started his second of 4 semesters to earn a master's degree in music composition at the prestigious Peabody Music Conservatory. If you want to listen to some of his music other than my beloved Itchy and Bitchy theme song, you can go to his website, forrestwentzel.com. FORRESTWENTZEL.com. Your health is in your hands. Itchy and bitchy, itchy, bitchy, itchy and bitchy.